Okay, now we're ready to put our TENS unit onto our patient here. And our patient has been having some neck pain, so that's where we're going to be putting it. And so we should have already verified the identity, or you can do that. You can also ask about contraindications if you haven't at this point in time. You don't have any metal up in your neck area at all, do you?
None.
None?
None, no.
You don't have a pacemaker or a defibrillator?
No.
So no implants with that?
No.
Any problems with electricity before?
Never.
Have you used a TENS unit before?
Yes, I have used it.
Has it helped?
I had good results from it, although it was not the cure, it was a good temporary fix, with emphasis on temporary.
So it helped decrease the pain for a little bit, right?
Exactly.
And that's exactly what TENS is supposed to do. Now, if someone tells you no, you can, again, explain to them what they're going to be feeling, but you should do that anyways. Well, if you've used the TENS unit before, then you know that it does help the pain, decrease the pain, and temporarily. It doesn't take away the cause of the pain, but it does help to decrease the pain for a little bit, right?
Correct.
And how it does that is it stimulates the nerves, some of the larger nerves in your body, because it's the smaller nerves that actually carry the pain messages up to the brain. And so what it does is it stimulates those so that it can help take your mind essentially off of the other pain, and that's how it works. What you're going to be feeling is just a little bit of tingling. I'm going to put this on for a second. We have 2 AA batteries in here, so there's not enough to shock you. Sometimes though you can put the intensity up or the level of it so high that it does get a little uncomfortable, but I'm going to show you how to use this to make sure that you use it correctly when you're at home, okay?
Okay.
So we should have already done a skin assessment on our initial evaluation, so we're looking for integumentary to make sure everything is still intact. If you haven't done a sensory check, you should be doing that as well. So we can do that really quickly and say, sir, what I'm going to be doing is I'm just going to be touching you. Just relax for a second. Just like this. Do you feel that?
Feel it, yes.
Okay. And I want you to close your eyes. I want you to tell me when you can feel it back up in through here when I touch. You ready?
Now. 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 Now.
All right, good. So we've done that. That's good enough. It's in the area where our electrodes are going to be. Do you have any numbness or tingling anywhere up in this area down the arm?
Not at all.
All right. So we're going to place our electrodes. We're going to clean the skin first with some alcohol to make sure that we have any oil or grease or lotion or whatever off. In this particular case, we're going to put the electrodes on across the spine so that our waveform is going to go from one to the other.
Not directly over.
Not directly over the spine, correct, but we are going to go from one side to the other. All right, we're going to start off with our continuous setting, and we're just going to do the high frequency TENS since that's more comfortable. All right, Byron, I want you to tell me when you can feel something.
Now.
All right, and what's it feel like?
It's a little bit strong. Feels a little tingle. It reminds me a little bit of my arm or leg where the so-called goes to sleep.
Okay. It's not uncomfortable though, right?
Yes, no, it's not uncomfortable.
All right, well, I'm going to turn it up just a little bit. You tell me when it does get uncomfortable.
Now.
All right, so it took 2 more presses here. This one goes up, it's just numbers, so it goes up a half each time, every time you press it. Now, is that tolerable though? Is it comfortable for you?
Sure.
Okay, so this is where we're going to leave it, and this is the constant. You feel that tingling, that it's pretty much the same all the time, is that correct?
That's correct.
All right, but it's comfortable for you.
Mm-hmm.
Okay, good. So this is for continuous. This is where you can leave it, and you can just leave it set this particular way. If he was having some numbness and tingling going down an arm, I can take another set of electrodes and set that up along the dermatome here to help decrease the pain that goes up the arm. Now, usually when I'm working with the patients, I will have them try different settings just so they can see where they get their best relief. Before you make any changes, you need to make sure that you bring it back down to 0. So we did that. I'm gonna flip him over into a modulating mode. And we're gonna modulate pulse width or pulse duration. Actually, let's do the frequency. And so now again, I'm gonna turn this up for you. All right, tell me when you feel something.
Now?
All right, is it uncomfortable?
No.
All right, now do you feel that same? How does it feel for you again?
Feels similar, but not quite, not exactly the same, but it still feels very similar.
Okay, does it feel like it's going up or down at all?
Does feel like that.
Okay, so it does feel like it's going up or down. So that's that modulation. And actually, I don't know if you can see it on here, but it is going up and down on the unit. So it's modulating from 120 down to 35, and it's doing this very quickly. And the reason why we want it to modulate is to avoid what's called accommodation. And accommodation is where your nerves get used to a certain feeling. For example, you've got your hands resting on your legs there. If you kept your hands resting on there and didn't move them or didn't change it, after a while your nerves start to ignore that because it's like, well, they're safe, they're not hurting us. And so the nerves just kind of ignore that sensation. The same thing can happen with this TENS unit, is it can start to ignore it after a while. And so we can use these modulation settings so that your nerves don't have that opportunity to accommodate, okay? Is that pretty comfortable for you?
It's fine now.
All right. I'm going to turn it back down and we're going to try the strength duration curve. And so again, remember, this is where we've got the pulse duration, the pulse frequency, and the intensity are all changing. All right, again, tell me when you can feel something.
No.
All right, let me know when it gets to be a little uncomfortable.
That's a little too much.
Too much there. Yeah, how about right there?
Fine.
Okay, so now my pulse duration is changing, not as fast as my pulse frequency is, but the intensity should be feeling. So what does this feel like for you?
Feels almost like a swing. The intensity is going back and forth.
From one side to the other?
Exactly, yes.
Okay. So again, ask your patient, get some feedback, let them, find out what it feels to them. Is it comfortable?
Fine, it's
All
fine.
right. And if he was having pain in this area, I would be asking him which one really helped to decrease his pain, or maybe had an impact. A lot of times it's just what they feel most comfortable with. With those 3 different settings that we had, which one did you like the best?
This, probably the modulating, the second one.
So the second one, okay? And again, everybody's different, so it's going to be whichever one that they feel the most comfortable with. I'm going to turn this back down, and one of the things we're going to go to is to a low frequency setting. And so now I'm going to increase my pulse duration to 150. I'm going to decrease my pulse width. Let's put it down to 10. All right, and now we're going to turn it back up again. Okay, you ready?
Okay.
Tell me when you feel something.
Now.
And can I turn it up a little bit more?
A little bit. It's starting to get a little uncomfortable.
All right, so that's uncomfortable. What's this feel like?
Feels almost like something is beating on the skin.
Mm-hmm.
Just the contractions feel like just a very light tapping on the skin, alternating on each side.
Okay, so in this particular case with the low frequency, remember this, we did this in the lab. You can actually feel the individual pulses that are coming up, because now he's at 10 hertz. So it's much lower. When you get up into that 100, 120, 150, they come so fast you can't differentiate between the 2 of them. In this particular case, we are utilizing the yourself opioid system, and so we are only going to have this on. You would inform the patient, or if you're using this in the clinic, you would only run it for about 30 minutes and then turn it off, because after a while it can get to be a little noxious. Okay, and then I'm going to turn this back down. We're going to do one more setting. We're going to do the brief intense, where we have the high pulse duration as well as a high pulse width, just so that you can tell me what that feels like. You ready?
Okay.
You remember we turn it down in between each time we change. How's that feel?
Not extremely uncomfortable, but it's not as comfortable as the others are.
Okay. What's it feel like to you?
Just feels like there's more intensity in the local area rather than going from side to side. Just feels like it's more around the electrodes.
Okay. And I was not able to increase the intensity as high as what he's been able to tolerate in some of these other settings. So after we're all done, let's say you're using this in the clinic, you maybe use the landline like one of the Chattanoogas. You're going to again turn this all the way down and turn the unit off. We're going to remove the electrodes, be asking questions. So how did that feel for you?
Helps it make it feel a little better.
Made it feel a little better? What's your pain rating right now?
Gave some relief right now.
Good.
Went from a 5 down to a 3.
Oh, that's pretty impressive. So you want to make sure that you do your follow-up with your patient and check your outcomes.